turn to an issue we've covered a number of times on this programme over recent years: unregulated providers performing cosmetic procedures like Botox, which require a prescription. Well, now the Nursing and Midwifery Council says it's closing a loophole which allowed nurses and midwives to prescribe without seeing the patient. And as of June, prescriptions will have to be done face-to-face. Jackie Partridge is Honorary Member of the British Association of Medical Aesthetic Nurses and Clinical Director of Dermal Clinic in Edinburgh. Good morning to you, Jackie. How significant is this?
Oh, it's a huge step forward for patient safety. We're absolutely delighted. This is something that the British Association of Medical Aesthetic Nurses and the doctors have been campaigning for many, many, many years. 1st of June should put patients in a better position for patient safety.
I have a very basic question. Why were nurses and midwives providing things like Botox, prescribing things like Botox?
You would question that, and I do question that. I personally don't do that, have never done it. But there are some nurses where, because it wasn't banned by our governing body, the Nursing and Midwifery Council, it was an income stream. That's the bottom line. So they were using it through online platforms, apps that are available to the public, and they were providing these prescriptions which were then being administered to the public without any face-to-face consultation. So it's sad when obviously finances start to take the lead in a medical decision-making process, but certainly this coming in now on the 1st of June should really, really help to make patients safer.
So what will it mean practically?
Well, practically, most of us are seeing patients face-to-face anyway. So, for example, our patients at Dermal Clinic won't have any change in their care. But people who are perhaps being looked after by somebody who's not a healthcare provider, so a beautician, for example, that beautician may well have been getting their prescriptions from a prescribing nurse who hadn't met the patient. That will have to change.
And will it have to be in person, or could it be done on a Zoom call? Or
no, Zoom, online, everything is not going to be acceptable. It will have to be a face-to-face. That also goes for emergency situations where if somebody has to prescribe hyaluronidase, which is a prescription medication to dissolve dermal filler in cases of an emergency, that must also be done with a face-to-face consultation. And if somebody requires a follow-up consultation or a follow-up treatment to have a little bit of a tweak to whatever they've had done, that again will require a face-to-face consultation.
Thank you for explaining all of that. Jackie Partridge there, an honorary member of the British Association of Medical Aesthetic Nurses.